healthcare management, and operations management. In the following presentation, I'm going to talk about healthcare management and the internal management of operations. Healthcare operations management is a field that combines scientific beliefs of management to define the most efficient and ideal ways to support patient care and the delivery of that care. In other words, it changes the way resources are given, such as labor, technology, and equipment, and how the care to the patient is given. The managers of operations strive to help reduce costs and inconsistencies. They try to enhance logistics, conditions of customer service, and business procedures. Operations managers help guide others to use their decision-making skills, maybe even ones they didn't know they possessed. They also are continually organizing, directing, and adjusting to all aspects of the organization. In some ways, they may be looked at as the gatekeeper of the facility. Another practice of operational management is to oversee methods to create the greatest level of productivity within an organization. They transform materials and employment into goods and services as economically as possible to boost the profit of the facility. Their impact on recognizing where the deficiencies or overstaffing in the facility is very important. These managers are involved with training and motivating people from the top to the bottom of the organizational chart they helped produce. They should look into the external influences, but also understand the strengths and weaknesses internally to help guide the hospital in the direction of quality care. Administrators should use the manager as a liaison between them and the lower level staff to focus both sides on the quality of care the community is asking for. One of the biggest issues in today's operations management is the rising cost of healthcare. Healthcare in the United States is expensive. In 2018, we spent close to $3.6 trillion on healthcare. This averages about $11,000 per person. CMS sees this number almost doubling by 2028. This number was estimated prior to COVID-19. Healthcare administrators will need to be very careful moving forward in the years to come, not knowing what the after effects of COVID will be. So how can hospitals combat against these costs, and how can they manage their budgets? Many healthcare organizations have begun to use a tool other companies use, called the Lean program. This tool is focused on becoming faster and more mobile by decreasing the amounts of supplies and waste in the facility. Companies who use the Lean method focus on recognizing and differentiating value-added behaviors from those that do not. The program emphasizes the usage of standardizations to lead to consistency and to help reduce waste. By recognizing the initial causes of errors, waste can almost be eliminated. Some issues that are at the root of the errors is the mindset of the individuals who feel they must have a large number of supplies sitting on the shelves at all times. To them, the thought of running out of something is not an option. The Lean program insists on culture change and mindset changes. By using graphs and picture presentations of what should be on the shelves can help every individual realize what is needed. Several years ago in our facility, we went through the Lean program. We looked at every shelf, every cabinet, every closet, and determined what supplies were really needed. Many times when we pulled things off the shelf, we're like, we don't know what this is even for. Can we just find what we need. We couldn't even find what we needed. We went through everything. We went and threw away many things. That was a waste. That was so much waste that we went through. We decided to streamline everything that we had down to the point of only having 2 to 3 of each product on our shelves at one time. This has eliminated many costs in our department and many of the waste in the department as well. The cost savings was pretty much outstanding. Six Sigma also focuses on reduction of processes, but includes statistical data more in depth than the Lean program. It looks at conforming the processes so the customer's needs and expectations are still met. Six Sigma takes a more in-depth look at the entire picture. It asks for a definition of a process or problem. How is it measured? Analyzes the information to see how to improve on it, and then ultimately control the process to keep a form of standardization for the organization. Neither of these programs are better than the other in the overall picture of helping organize areas of the facility. Both achieve some aspect of reduction in cost to the company and time. If waste can be reduced, some of the costs that are rolled over to society should decrease as well, which should then benefit all, including insurance companies, who drive the costs of exams and procedures. Many times, though, change is looked as being disruptive. The old adage of, if it isn't broke, why fix it, comes to mind. The thought of switching processes is very hard for some individuals as well as organizations. Organizations are built on processes and procedures. These are developed over time with trials and tribulations. With those comes change. Trials or projects are designed to change processes, technologies, or practices. Change needs to have dependable management that has an operational plan with a stable strategy, with alignment of incentives with the individual who are supporting and working on the project, and have the adequate resources to complete the project. As with any change in project, communication is key for the success of it. Communication should be relevant to the project. To ensure that the change being proposed is accepted, an organization should try and steer away from some pitfalls. As already discussed above, communication is key. Another area that can cause anxiety amongst the staff is the reasonings behind the change. Are there alternative motives behind this change? They may fear that they are going to be demoted or even lose their job. Keeping communication simple and on point is essential. Addressing these concerns quickly and frequently will help calm the anxiety and minimize the pushbacks to the change. Many projects are looked upon as being negative from the start because individuals do not like change in general. Change management should try to reduce the disruptions of day-to-day lives of their employees until the new process is ready to be put in place. Over-communicating, as long as it follows the key message and helps reduce doubt, is usually much less of a problem than under-communicating. One of the best ways to certify that fear of change does not stop the project is to ensure support and teamwork up front from all central employees. This is often called buying in. Sometimes managers create a story or a vision for their change and then obtain support from others to ensure that no organizational obstacles prevent the project's advancement. A similar concept is the use of partnering, or establishing mutually beneficial and cooperative relationships with others. where trust and teamwork help create synergies. Partnering with others in similar roles or adjacent departments can help pool resources and energy to achieve greater project success. Are there any questions? Thank you for your time. Have a good day.